you there. Hey, my name is Jen Bromwell. I'm one of the cardiac fellows, and we're going to learn how to do an adult cardiothoracic setup today. First, we're going to work on our pump setup. So the way that we generally set up the pumps in the cardiac room is you have one brain with 4 channels that's dedicated to your vasoactive medications, your pressors, your uppers, your downers, and then we have a second brain that also has 4 channels on it that is more of your miscellaneous drugs. Your carrier is going to go here. Amicar is on the end, so it's readily removed at the end of the case. And these 2 other channels can be used for things like insulin, sedative medications like Precedex or propofol. On our first brain here, we have 4 channels again. The first channel should always be epinephrine if you're using it for the case. If not, it should be norepinephrine. The rest of the channels, you can add a second pressor here like norepinephrine or milrinone, and these 2 channels are typically reserved for downers if you're using them. When setting up your manifold in the cardiac room, you should have 2 manifolds together with a total of 8 places to plug drugs in. And then you have your traditional microbore tubing that goes on the end. There are 8 total channels in the manifold, and there are 8 total pumps here. So each place that you plug in a medication should correspond to its location on the pumps. So if you have a drug here in the first channel, it should go in the first channel of the manifold.
Squeal like a pig when you fucking.
There's gotta be a better way! As an organizational tip, make sure that your cords for your Laris pumps are both wrapped up. You can use these plastic pieces to tether them. This just ensures that the cords aren't on the floor and aren't going to catch when you try and move the pole back and forth. Managing the various lines and cords in the cardiac room is extremely important, not only for transport, but for purposes of organization. It helps to co-band or somehow tether together all the lines to keep them from getting excessively tangled. Okay, next we're going to talk about the monitors that we use. So the first thing we'll come look at here is our transducer setup. So anytime you do a cardiac case, we're going to have a total of 4 transducers. This is for your arterial line. If you're using a PA catheter, this is the yellow goes to your PA. The blue is going to go to your CVP or to a central line if you're not using a PA catheter. And this is your left atrial pressure, which is the transducer that you will use handed off from the surgical field. Next, we'll look at the rest of our monitors. We use our standard ASA monitors here in the cardiac room in addition to a couple of extra. So we always will set up some extra EKG leads so we can position them appropriate prior to the procedure. In addition, we'll use a BIS monitor, cerebral oximeters for either side of the head, and also make sure for every case that you have defibrillator pads available. The cerebral oximeter cables plug into this guy right here. And then we have our usual BIS monitor that's used as well. Additionally, in the cardiac room, we'll use 2 different temperature monitors. So we'll use a core temperature monitor, and we also place a nasopharyngeal temperature monitor as well. All right, next we'll talk about airway equipment. Airway equipment for the cardiac room is not substantially different than airway for any other particular case. Typically we'll place either a 7.5 or 8.0 high-low evac tube, but specific airway management should first be discussed with your attending.
Trying to build a prison.
So there's quite a few medications that you need to have ready for your standard cardiac setup. For every cardiac case, these are the medications that you should have ready no matter what. You should have at least 40,000 units of heparin drawn up, 2 syringes of aminocaproic acid or Amicar. One is going to be bolus at the beginning of the case, and the other one will be an infusion on the pump that runs at 1 gram per hour or 4 cc's per hour. The next, standard phenylephrine, and you should have some dilute epi drawn up in a concentration of 4 mics per ml. Other medications to have ready should be discussed with your attending. So, all right, end at that. Other vasoactive medications should be discussed with your attending, such as vasopressin or norepinephrine or esmolol. Your induction drugs usually include your standard induction drugs, but should also be discussed specifically with your attending. Alright, so the next thing that we'll discuss is all the different lines that we use. So for nearly every cardiac case you'll do, we'll place a central line. So this is a 9 French introducer that's found here at the top of the anesthesia cart. We'll also use a hotline for every case. We'll do a separate hotline with warm tubing, and we'll do a cold line, which is just normal blood tubing or Y tubing setup. Lastly, this will also be specifically discussed with your attending, but this is your PA catheter that's also found at the top of your anesthesia cart. The last thing that we'll remember to do is just order an echo at the beginning of the day so that we can record echo images for that specific patient. The echo that you want to order is this top one here, that's anesthesia, TE intraoperative with bypass.
Did someone call for an echo? Hold on. I need a holster.
I need a holster.